Is that a squirrel? All right. Today, I wanted to talk about ADHD. Current understanding of ADHD is what's called neurodevelopmental. So that means it's essentially, we think, something you're born with. Now, it's important that we take some of these things and these ideas with a grain of salt, because the reality is we just don't have clear, firm understanding. We have our best educated guesses. Now, we suspect that ADHD is something, like I said, that happens early on in development of the brain and likely related to a depletion of dopamine and norepinephrine, and impacting primarily the prefrontal cortex in certain areas of the brain related to focus, attention, task management, time management, things like that. One of the things about ADHD, or one of the ways I like to think of it, is it's kind of like a brain balance problem. So there's some areas of the brain that seem to be underdeveloped and other areas that almost are, in a sense, overdeveloped. People with ADHD also tend to struggle more with emotional regulation, have higher rates of anxiety, impulsive behavior. People with ADHD also tend to be really good at certain things. They might be really good at creative thinking, out of the box thinking, things like that. But one of the things that's interesting about ADHD, or that can be difficult about ADHD, is really trying to piece apart and delineate a lot of different things that can cause the core problems or core symptoms of ADHD, which is executive dysfunction. That's generally the reported symptoms that people have, is they're having problems with focus, attention. But problems with focus is probably one of the most consistent symptoms across mental health problems. If you're having a lot of anxiety, if you're having problems with emotional regulation or depression, that can also in turn cause problems with your executive function. So trying to delineate, is this a neurodevelopmental problem, or is this something else that's causing that, or is there a combination of things? And of course, the other question being, is that really what ADHD is? Because there's so many other factors that can influence this. Trauma is a big one. Actually, the rates of trauma in ADHD coincide. There seems to be higher rates of people with ADHD that have had some kind of adverse childhood events. Now, there's different ways of thinking about this, right? One is that we know that ADHD is highly genetic. Is it possible that people with a family systems that have historically struggled with these symptoms could secondarily generally present with higher rates of other problems like addiction, abuse, things like that? Or is it the other direction? Is it more that being exposed to these things in early development could actually lead to ADHD symptoms? Or is there multiple things going on? Are there people out there that maybe do have some kind of underlying neurochemical problem that manifests these symptoms? And there's also people out there that have had these kind of maybe more trauma or trauma-related symptoms. Now, another consideration in this, and that I think is something that it's important that we consider or think about, especially as we continue to learn and do more research, is it possible that ADHD has a relationship with diabetes? What I mean by that is not that they're the same thing, not that they're necessarily related, but in the sense that when diabetes was first discovered, we discovered type 1 diabetes, and it was thought that this is the only type of diabetes there is. It's an autoimmune problem where your body attacks the insulin in your system so that you're not producing enough insulin to deal with the blood sugar levels. Now, obviously, nowadays we know that's not true, and the most common form of diabetes is acquired diabetes, is type 2 diabetes that has been acquired generally through lifestyle. Is that possible with ADHD? I think yes. I think absolutely that's most likely the case, that we're seeing people who have maybe what we call ADHD-like symptoms, but it's not because they have a neurodevelopmental problem. It's because they have a lifestyle that feeds on their dopamine so heavily, and we live in a very dopamine-heavy world, that now they're manifesting these ADHD symptoms. That's an important consideration. So, when you have patients that present with these symptoms, because there's really high rates of diagnosing of ADHD, or at least it seems like it. I guess I haven't seen recently exactly what the numbers are, but I think most of us have seen lots of things. We hear a lot of different people being diagnosed, prescribed stimulants. I think it's important that that we really take a step back and think, okay, what are these patients? What symptoms are they manifesting? Is it likely, or is it possible that there's other things causing this? And one of the things with the DSM criteria is that you really do have to establish early onset of symptoms. This is why it can be difficult, is because even with those early onset of presentation of symptoms, that can look different for different people depending on the scenario, right? You could have someone who has hyperactive symptoms as a child, but maybe it just didn't manifest in the classroom because they were scared. Maybe they were in an abusive home, and they were scared that if they acted out of line, there was a high enough thing to kind of keep them in check, but that maybe in turn affected other things, right? There's so many moving pieces in this, and on either side of the coin, there can be things that we can kind of make sense of, that can give us evidence towards, or maybe make us move away. This is why it is so important that clinicians develop good relationships with their patients, that they have the time, that they have the attention, and then they have the desire to actually understand what is a patient's story, what is going on. They can get the big picture. It's so important because we're not just dealing with a list of symptoms. We're dealing with a person with a particular life, particular symptoms. It has to be there, right? We need to be in a system. We need to have systems in place that support that don't just support making money, that don't just support acquiring, higher growth and all that. Supports actual healing, actual improvement of life. That being said, I am accepting new patients. If you are in the state of Idaho, please find me at sparrowmentalhealth.com. Find out more. Click like, subscribe, comment below. Let me guys know your guys' thoughts or experiences with whether you've been diagnosed, whether you think you might have it. Let's create some conversations and start talking about this.